Hi and welcome. My name is Bengt Andersson and I work at the Nordic Welfare Center, that is an institution under the Nordic Council of Ministers. And I'm going to present a project that we have been running for 3 years. It's called Healthcare and Care through Distance Spanning Solutions. But first I would like to tell you a little bit more about the Nordic Welfare Center. The Nordic Welfare Center is an institution under the Nordic Council of Ministers, and we have offices in Stockholm, Helsinki, and we have around 30 employees. And we work in the areas of public health, disability issues, integration, and welfare policy. And that's in the welfare policy area, as I work as a senior advisor in the area of welfare technology or distance or digital transformation in public sector, as I more often say. Before I start presenting this project, I thought I maybe could present two other activities that we are running from the Nordic Welfare Center. The first one is that we have a Nordic research network called Health and Welfare Technology. We have, in fact, 75 researchers from all Nordic countries in this network, started up in 2019, so we've been running this network for 2 years. We have a focus on user perspective, both end user perspective, but also perspective on and staff and relatives to end users. Norway is well represented, plus they also have the Norwegian Center for E-Health Research that has an important role in this network. And we have two ongoing research projects. One is called Protect, it's financed by the Suomi Academia in Finland, and we also have Nordiskt Forskarnätverk. It's a project that is funded by Forte in Sweden. And the second activity that I want to highlight is also that before I start talking about healthcare and care to distance spanning solutions, is that we have a quantitative follow-up of the Nordic municipalities' pace of implementation regarding welfare technology. And how many individuals has welfare technology services. And we have a working group with the National Board of Health and Welfare in Sweden, together with the Norwegian Directorate of Health. And we are looking into 4 KPIs. It's safety alarms, mobile safety alarms, medicine dispensers, and digital visits. And in fact, we have figures for safety alarms. We can see here the number of individuals with safety alarms per 10,000 citizens in total. This is all individuals in Norway and Sweden that has a safety alarm, but we sort of boil it down to looking into 10,000 citizens. And we can see on the base of 10,000 citizens, there are almost the same numbers in both Sweden and Norway, around 200 people in a municipality of 10,000 people, there is 200 people that have safety alarms. So we could say that we have sort of quality assured the data we have. We can also say that we probably have met the needs both in Norway and Sweden when it comes to safety alarms. But when we look at mobile safety alarms, also called GPS trackers and so on, the mobile alarms that works outside your home, differs quite a lot. You see that the numbers in Norway going up much more than in Sweden. There've been a same plateau in Sweden since 2017, in fact, but it's going up in Norway. But as you see, it's only 6 individuals per 10,000 in Norway that has, and only 1.74 individuals in Sweden that have these mobile safety alarms that works outside, if you compare to the safety alarms that we had over 200 people. So there's a journey to make when it comes to going on and having safety alarms working outside, because it's important to go outside and be active and dare to move around. Briefly about our vision for the Nordic Council of Ministers. The Nordic region will become the most sustainable and integrated world by 2030. That's the goal. And when there are 12 objectives aiming at that. These objectives are very similar to the Sustainable Development Goals of the global goals for 2030, of course. And the first of these 3 areas that we're focusing on is a green Nordic region. Working on carbon neutrality, biodiversity, circular and bio-based economy, sustainable consumption, and also international cooperation. When it comes to a competitive Nordic region, knowledge and innovation is important, of course. Well-functioning labor markets and digitalization and education. We at the Nordic Welfare Center, we of course work most in the social sustainable area. Where health and welfare is crucial, health and welfare model, but also inclusive transformation, civil society, and cohesion. And how will we work and achieve the objectives then by 2030? Well, there is an action plan for 2021 to 2024, aiming to work at develop and guide and monitor and communicate the Nordic Council of Ministers' key activities to achieve the vision of 2030. And there is a cross-sectoral cooperation that is crucial. We see these areas are interlinked a lot to each other, so there's a strong need for cross-sectoral cooperation. Also involvement of civil society more than what we have been doing. And again, integration of cross-sectoral perspectives, because as we said, these things goes together. And we've been working a lot of indicators when it comes to this. Following up, of course. And those indicators that we point out for us in the welfare sector is good health and well-being, gender equality, reduced inequality, peaceful and inclusive societies, and a strong cultural scene. But we can also see when we work with distance spanning solution, healthcare and care to distance spanning solutions, that we also go into the areas of a competitive and also a green Nordic region. When it comes to competitive Nordic region, decent working conditions, innovation, sustainable citizens, and also freedom of movement. And on the green Nordic region, of fighting climate change, and I will come back to that more in detail. Because now I will, with this background with us when we looking into what we've been doing for the last 3 years, I will go through this healthcare and care through distance spanning solutions project. We have a situation with a demographic challenge. We have been talking about this for quite a long time in the Nordic countries, but in fact now we are sort of there. We see that there are very large areas in our Nordic regions that are having problems when it comes to recruitment. The demographic, if you go into numbers, we can see regions up in north of Finland, Sweden, and Norway that has over 30% of the population is over 65 years old. So it sort of threatens our Nordic welfare model, both when it comes to financing, but also when it comes to how should we make this model works, having the same quantity and quality of our welfare system, both in healthcare and social care. And that is why we started up this project 3 years ago, when it focusing on the rural areas, because also seen in the perspective that things that maybe works here in Oslo, where we are right now, or in Stockholm, or in Copenhagen and Helsingfors, probably won't work in north of Sweden, rural areas in Norway or in Finland. But the other way around, could it absolutely work? We could see if we could have interventions and solutions that works in rural areas. They probably work very well in suburban areas. what we've done is looking into different aspects of distance spanning solutions out of a healthcare and care perspective, a combined perspective when it comes to healthcare and care. And there is a website called healthcaredistance.com where we have sort of summarized and gathered the knowledge and the studies and reports that we've been working on over these 3 years. We call it a knowledge hub. So you can go in, and after this presentation, go in and look in even more further into the details of what we've been doing. But I will take you through these 8 blocks and explain what they consisted of and what we've been doing. And the first block is existing solutions. What are the solutions out there? In this area of e-health, telehealth, welfare technology, or as we call it, distance spanning solutions, we've been seeing a lot of projects, a lot of pilot projects. I worked on national level in Sweden 10, 15 years ago in this area, and I can see that the project we started up there has been going on and changed maybe shape, but going on as projects, unfortunately. But what we did was starting up in 2019, seeing what kind of services are out there for real. Services that are not projects, not pilot projects. And what we came up and found was quite a lot of examples, but we sort of boiled this down and made a publication that is presented as existing solutions. And we came up with 24 practical examples where you can study these services, is both healthcare services and social care services or welfare technology services that are the foremost responsibility in municipalities. And you can find here, for example, services as home monitoring for persons with chronic diseases as COPD, internet psychiatry are presented here. Also, things like the mobile safety alarm that I talked about earlier, the GPS tracking mobile safety alarms, but also digital night visits and services for social inclusion and medicine dispensers are also examples that are presented here, because they are services that are in place on several of our regions and municipalities around the Nordic countries. But we say if all regions and all Nordic municipalities, I think there are over 1,100 municipalities in the Nordic region, had implemented these 24 services, then we probably wouldn't have the challenges that we see that we have. So this publication is possible to download. It's available both in Swedish and in English. The second part is that we've been looking into how to implement. We hear a lot that it's not so much about the technology. It's more about culture in organization. It's hard to work to change how you work. Going from an analog service to the digital service. So we mapped what all kinds of national guides and guidelines, strategies and visions from all 5 Nordic countries and gathered them and presented them in a report. And we also, when we did this, we also found a Veikart for tjenesteinnovation, the Norwegian roadmap for service innovation that has been developed in the welfare technology program here in Norway as the most sophisticated and most well-worked program and tool that we could find. So what we've been doing is that we've continuously worked with this roadmap for service innovation and the 6 phases that is included in this roadmap, and we have translated it into all Nordic countries. So there is it's available on Swedish, Danish, Finnish, and Icelandic, but also in English, a roadmap for service innovation. And I know that in Sweden they are now working on a quite strategic level on developing and translating all the details of this tool to start working on it on a more, as I said, strategic level in municipalities and also regions in Sweden. And you could really lean on this roadmap for service innovation when it comes to looking into where should we go when it comes to implementing distance spanning solutions. So with that in mind, we also had some funding for external projects. So we made 2 calls and we wanted to get knowledge how they could work with this roadmap for service innovation. So we have funded 21 projects, overall 52 municipalities and 8 regions that were supported. And we asked them all to, they had to work with this roadmap for service innovation. They had to work with Veikart for tjänsteinnovation. All these projects, they have sort of come quite far in their journey to implement distance spanning solution service, but somehow got stuck and couldn't really work with scaling up. So we have consultative support giving them the support via the roadmap for service innovation. And a quick summary of the results were that they sort of all 21 projects had gone too fast when it comes to choosing their technology and start piloting. They have missed the 2 phases of the roadmap for service innovation that is anchoring and insight. They haven't worked with the stakeholders when it comes to anchoring and insight. So they have to start all over again, sort of, or back their process to anchoring and insight. And after that, it was going for most of these projects very good. They have scaled up and escalated their services to be functionally services out in their regions and municipalities. So we could again emphasize that that this roadmap for service innovation is really a tool that works. Even if you have started in the wrong direction from the beginning, you could use it. But the best is if you go in on the journey to use this roadmap for service innovation in the beginning. What we also have looked into as an extra assignment we got is competence provision impact. The question was, has the way of working with distance spanning solutions, welfare technology, telehealth, e-health, has that an impact on recruitment of personnel, on competence provision? Is there a difference if you use these kind of services compared to using the analog services? So we looked into, and we know that there are areas that have come a little bit further in when it comes to using distance spanning solutions. In one region in Finland, one in Norway, and one in Denmark. And we did interviews with personnel, AR management, to see what could we conclude of this. And the result is published in a report called It's All About People. And we can say the main finding is that digital transformation is a key to create a good working environment for health and care personnel. They think that it's much more fun working. They like their job more. They don't want to go back to work as they did before. They want to go further and use this as they are less stressed. They're less sick leave, etc. So the working environment, we couldn't really say that this has an impact on recruitment, but that may said, it could also be that they didn't use this, that they have come further in this area. They didn't tell when they needed a new personnel that this is the way we work. So that was maybe a wake-up call for them to highlight more that they work with digital solutions. Yeah, we have made a different presentation material on this, and we will look in further into this, because this is really scraped. We have sort of scraped on the surface here, but we think with this is very important to go on, because we see in contact with the national organizations for municipalities like KS in Norway and KL in Denmark and SKR in Sweden, that there is a huge challenge when it comes to recruiting personnel the upcoming years. There will be a lack of personnel, and one of the solutions to work with is digitalization. Also to make these jobs attractive now and in the future. Yeah, I will go further on, because next block that we've been looking into is a report that is not published yet. It will come in December. But we looked into the climate impact. And that, of course, is interesting now when we have this COP26 going on. Does this really have an impact on, has distance spanning solutions and welfare technology really an impact on CO2 emission, for example? Yes, it has. We've been looking into a scenario together with Stockholm Environment Institute. There is a research institution that is very focusing on SDGs and climate impact. And they have, together with our sister organization Nordregio, been counting on a couple of scenarios where we use distance spanning solutions instead of using traditional way of giving services. And it is the report will show that it is a major impact on CO2 emission using these distance spanning solutions. And we would really like to look more into details. And if you remember when I talked in the beginning about our vision of 2030 with the sustainable goals, for social sustainable goals, that we also had impact on the third one here, the green goals. This is where it goes in, and we have cross-sectoral perspective that is really interesting. The next area we've been looking into is the user perspective. And here was the question, what do the users really think? We often talk about this perspective of distance spanning solutions and welfare technology from an organizational perspective, of an economic perspective, of an effectiveness perspective. But the real important group here is the users. What do the users think about distance spanning solutions? So what we did, we asked the network that I mentioned in the beginning of this presentation, our Nordic Network for Health and Welfare Technology, to look into this. And what they did was that they did a scoping review, focusing on 42 publications made with the focus on health and welfare technology, distance spanning solutions. And what they conclude in this report, that it could be downloaded from our website. It's called Nordic Research on the Effects of Welfare Technology. Is an extremely positive picture. There is, in fact, no one of these 42 publications that are sort of building up a picture, showing a picture that users are sort of negative to using welfare technology. As the staff, we could say all of the users that have been in these studies says that they don't want to go back to have the services as they had earlier on. They prefer to have the digital services. Although that said, we looked more detail into these 42 publications. There's always a back side of everything, but when looking into it, they are quite small quite smaller number of users in each publication. It could be a study of looking into how 8 to 10 users follow up 8 to 10 users. And with that said, we conclude in this report that we need to do more randomized studies with a larger group of users, because you could think that the users they have been asked to participate in these publications, in these studies, were quite positive from the beginning to using these technologies. So we need to do more research really to state the things that I have stated here, that the users are very positive, because as I said, there is this other perspective of we need to do more research. But of course, it's good that we have this publication showing up that is a positive point of view from the users. The third, the seventh, the seventh area we looked into is how to scale up. And in that in mind, what we mean by that is more from an data collection level. The background is that when we look into these areas that we've been looking further in detail, these regions that have been working more with distance spanning solutions, welfare technology. For example, we know about Agder region here in Norway, that they the municipalities have implemented most of the services that the Norwegian welfare technology program has said that they should do. We see that the data that the services that are out there, they generate a lot of data from each and every individual. How should we really handle all this data? And how could that be maybe a possibility or a barrier for scaling up? Is something that we haven't gone so deep into, but we've been looking into it. And the case study here, the response services in Norway, I know that, and I also heard here at EHiN on other presentations when it comes to response service centers, that this is crucial for the development of distance spanning solutions and welfare technology, that we know to handle all these data, these kinds of digital services generate. Because we also looked into, we did an overview of function for so-called wearables like Apple Watch or Fitbit or Garmin watch. And we sort of looked at could these kind of mainstream wearables have the same function as these 24 services that we presented in our first part of this project. And we saw, yes, there's a lot of functions that we have in these mainstream wearables that could be a part, could exchange the services we have, and how could we handle that in a best way? And I think we're up in somewhere in the future here, but we think this is an area that will increase, and also this is also hard to understand and to know, to develop when it comes to who owns the data from a mainstream wearable. We have these large companies like Apple and Google that knows maybe more about us than we know, and could we also use that in these kinds of services? Yes, we're absolutely sure of that. But how do we get that into our systems, and how will that work? And who owns the data? There are more questions about this than maybe answers, and we will I come back to that, but we will look in more in further detail in the upcoming years. Yes, the last area here that we've been working on is the contribution to regional development. Our sister organization Nordregio has been working on looking into 7 regions in all 5 Nordic countries, but also on Greenland and Faroe Island. How does distance spanning solutions, do they have an impact on the welfare system out of a regional development perspective? And I have no more slide about that, but you could go into their Nordregio's website and look into the result. And absolutely, you could say that the Nordic welfare model and the Nordic the healthcare and welfare system is really a base for having a regional working. Regional development relies on having a functioning welfare system, and one area that one kind of solution that makes us secure the welfare system for rural areas is digitalization and health and care through distance spanning solutions. All right. As I showed you, our vision for the 2030 is that the Nordic region will become the most sustainable and integrated region in the world. With presenting 8 blocks and what we've been doing over the 3 years, we could say that we go into these indicators that we are in all 3 of these areas. We could say that we were working against fighting climate change when it comes to CO2 emissions, where this spanning solutions and digitalization has an impact on also on health and care welfare system. Decent working conditions. Yes, we can see that as I presented in our results that the work staff we interviewed in when it comes to competence provision and recruitment, they don't want to go back to work analog. They want to work more with the digitalization in the services. And we can say that innovation is, of course, one thing of this area, and sustainable cities and communities when it comes to regional development. And of course, everything that we have in social sustainable region is what we're working when working with distance spanning solutions. So with that in mind, we have had the opportunity to work with a new assignment for the upcoming 4 years, and that is called integrated healthcare and care to distance spanning solutions. And that's the main difference towards more integrated. Also saying that integrated healthcare and care to distance spanning solutions is the answer to moving more into your home. Even if you have several chronic diseases or could be in fact quite ill, you could get the best but the medical services and also social services in your home. Moving out, decentralizing healthcare and care, making them more integrated, both also because we have silos in most of our countries between healthcare and social care, and we need to move more to more work integrated there. And you can't do that if you don't work with digitalization. And this focus, of course, foremost on a social sustainable Nordic region, but it also cross-sectoral perspective, as I said, labor market, climate impact, regional development. And what we will do now, what we have started up, is to focus on model regions as ecosystem for integrated healthcare and social care. So we will start mapping. Are there any regions out there that are working with integrated healthcare and care successfully, and what components do they have in their ecosystem that makes them successful? So we will look into that. We will also look into what are a model region and what is an ecosystem for integrated healthcare and care, and what components should be in place. We work together with the EU in this and others. So we will present a publication in June 2022 with both a theoretical part of this, what is an ecosystem or model region and what components, and also example 5 to 8 regions that we will present in this report, and their components to being a successful ecosystem for integrated healthcare and care through distance spanning solutions. The second part is that we will map national and regional models for integrated management of healthcare and social care data. There is where this response services comes in. Also seeing how could we integrate wearables and mainstream products, and where do they fit in, and how could we use this, because we are quite sure of that is the future coming up, if not in the Nordic countries. So we think a lot of the insurance financed areas, regions in the world will look into using this kind of data in more what they do today. And finally, we will also make it possible for sort of model regions, wannabes, regions that will go further in the next step, to give support, consultancy support and expert support to based on what we've mapped from the first part of this project, to give them support between 2022 and 2024 to develop their regions and the municipality integrated together to try to become model regions working on their ecosystem. Okay, that was in fact all from me. I know that I have more time. I went a little bit quicker than was planned for, but this is my last slide. So with this said, I thank you for presenting, being able to come here to present this. Thank you.